Hello everyone, good morning. I am Ina and friends. We will share about effectiveness of tempe biscuit and honey to decrease frequency of stools in children diarrhea. Diarrhea is a change in the frequency and consistency of stool. According to World Health Organization, in deviant diarrhea is liquid defecation 3 or more times a day and overnight 24 hours. Diarrhea is deviant into based on the time of the onset, namely acute diarrhea less than 2 weeks and chronic diarrhea more than 2 weeks. Diarrhea is disease characterized by change in shape and consistency of softening stool until it melts and the frequency of defecation increases more than usual 3 times a day. Diarrhea often attacks infants and toddlers. If not treated immediately, it can cause dehydration, which causes death.
He studied appellate resting method using experimental resting design, which experiment we work with imposters. Posters 9 which they received with a comparison of intervention from group derived with different primary group. They populated in his study where Calder was experimented right at the time of his study until 3 children.
The result in this study, it is shown that the distribution of respondents based on observation of defecation frequency on the first day before administration of tempe biscuit with honey in diarrhea children indicate that the frequency of diarrhea 1 until 3 times a day, both intervention group tempe biscuit and honey intervention group respectively as many as 1% or 6.7%. Meanwhile, the frequency of diarrhea more than 3 times a day in both intervention group of tempe biscuit and the intervention group of honey were 14 people or 93.3% respectively.
Furthermore, it is also shown that the distribution of respondents based on observation of defecation frequency on the fourth day after administration of tempe biscuit with honey in diarrhea children. The result in each intervention group showed that the tempe biscuit intervention group with a frequency of defecationing 1 until 3 days was 14 people, while the honey intervention group was 15 people. It can also be seen that after the intervention of tempe biscuit and honey in the honey intervention group, there was a greater decrease in the frequency of diarrhea compared to the intervention group of tempe biscuit.
Diarrhea in infants and toddlers is a big and very complex problem, especially because some sufferers fall into chronic diarrhea or continued diarrhea, and the patient's nutritional condition becomes very bad. The tempe formula is a nutritional treatment in diarrhea. This aims to cut the malabsorption, malnutrition, infection cycle. Because the tempe formula contains high amino acid and is usually digested and easily absorbed, and tempe is antibacterial, so that the majority of the causes of diarrhea are bacteria, and tempe proves its ability to cure diarrhea disease and treatment after diarrhea episode. The ability of tempe to cure diarrhea disease is caused by two things, namely the
to diarrhea, substances, and due to the nature of tempeh protein that are casually absorbed even through the injured intestine. In addition, giving honey is also effective for the treatment of diarrhea in children because honey has an antimicrobial effect. The antimicrobial effect will inhibit the growth of large bacteria and fungi. Thus, giving honey is quite effective for handling diarrhea in children.
The next topic we will share about complementary alternative medicine with the new fever. Complementary and alternative medicine (CAM) is a group of various medical and healthcare system product precise approach, knowledge, and belief which are not universal as part of conventional Western medicine for maintaining well-being. The National Center for Complementary and Integrative Health classified CIM into 5 subdivisions: biological-based therapies, alternative medical system, and mind-body intervention. For the site, several studies have shown the positive effect of CAM for the new fever treatment, especially the fresh papaya leaf extract, bitter melon, green carta bananas, double boiled frog with bitter ground soup, and the wild crab soup are the famous dishes used as CAM for treating the new fever among Chinese ethnics in Malaysia.
This is a study of patients with dengue fever attending the dengue clinic at Hospital Serdang, Hospital Kajang, and Hospital Kuala Lumpur, Selangor, Malaysia. All patients above 18 years of age presented with a history of fever and evidence of thrombocytopenia, platelet count less than 115 by 10(9) per liter. With or without the new seropositivity were eligible for study. The data collection with face-to-face interview was conducted by using a questionnaire. In this study, complementary alternative medicine use was defined as the consumption of at least one out of the 5 types of complementary alternative medicine therapies: biological-based therapies, there is herbal and dietary supplements, alternative medical system, energy therapies, manipulative and body-based therapies, and mind-body intervention.
A total of 320 patients with dengue were eligible for the study. Out of these, 20 patients refused to participate in the study. In the end, 306 patients with dengue fever were enrolled into the study with a response rate of 93.9%. Total of CAM use of the patient with dengue fever was 95.3%. The types of CAM used by patients with dengue fever: biological therapies that involve dietary supplement 98.1% and herbal product 22.2% were the most commonly used. The most popular type of CAM was isotonic drink 85.8%, followed by crab soup 46.7%, papaya leaf extract 22.2%, coconut juice 20.3%, and watermelon 70.2%.
According to our group, the study demonstrated the CIM used among patients dengue fever was high. A higher level of the patient was known to be the factor associated with CAM use. The most common CAM use among dengue fever were isotonic drink, crab soup, and papaya leaf extract.
The news is separated in various countries and there is no specific treatment. Complementary and alternative medicine, CAM is a group of various medical and healthcare knowledge and belief related with dengue using CAM as such the extracts of charica and other dietary complements as they believe that CAM is more effective. Again, the results show a rise in the dengue patient and the results show a significant increase in the platelet count of this patient. Some of the patients claiming that having isotonic drug was useful, however it saw no proof including UDF. In this study, we found that 1/3 of the patients with DF used CAM because they had a good impression of CAM from other CAM users. This has usually been under the influence of other patients in the same hospital and they believed that CAM can relieve their symptoms and help them recover faster from DF.